What is a mammary gland? The breast or mammary gland is the most important structure present in the pectoral region. Its anatomy is of great practical importance and has to be studied in detail. The breast is found in both sexes, but it is rudimentary in male. It is well developed in the female after puberty. The breast is a modified sweat gland. It forms an important accessory organ of the female reproductive system and provides nutrition to the newborn in the form of milk. Situation: the breast lies in the superficial fascia of the pectoral region. A small extension called the axillary tail of Spence pierces the deep fascia and lies in the axilla. Extension: vertically, it extends from the second to the sixth rib. Horizontally, it extends from the lateral border of the sternum to the mid-axillary line. Deep relations. The breast lies on the deep fascia, that is the pectoral fascia covering the pectoralis major. Still deeper, there are the parts of three muscles, namely the pectoralis major, the serratus anterior, and the external oblique muscle of the abdomen. The breast is separated from the pectoral fascia by a loose areolar tissue, sometimes called the retromammary space. Because of the presence of this loose tissue, the normal breast can be moved freely over the pectoralis major. The structure of breast can be conveniently divided into the skin, the parenchyma, and the stroma. The skin covers the gland and presents the following feature. A conical projection called the nipple is present just below the center of the breast at the level of fourth intercostal space. The nipple is pierced by 15 to 20 lactiferous duct. It contains circular and longitudinal smooth muscle fiber which can make the nipple stiff or flatten it respectively. It has a few modified sweat and sebaceous gland. It is rich in its nerve supply and has many sensory end organs at the termination of nerve fiber. The skin surrounding the base of the nipple is pigmented and form a circular area called the areola. This region is rich in modified sebaceous gland, particularly at its outer margin. These become enlarged during the pregnancy and lactation from raised tubercle of monogamy. Oily secretion of these glands lubricate the nipple and areola and prevent them from cracking during lactation. Apart from sebaceous gland, the areola also contain some sweat glands and accessory mammary glands. The skin of the areola and nipple is devoid of hair and there is no fat subjacent to it. The parenchyma is made up of glandular tissue which secretes milk. The gland consists of 15 to 20 lobes. Each lobe is a cluster of alveoli and is drained by a lactiferous duct. The lactiferous duct converges towards the nipple and open on it. Near its termination, each duct has a dilatation called a lactiferous sinus. Alveolar epithelium is cuboidal in the resting phase and columnar during lactation. In distended alveoli, the cells may appear cuboidal due to stretching, but they are much larger than those in the resting phase. The smaller ducts are lined by columnar epithelium, the larger duct by two or more layers of cell, and the terminal part of the lactiferous duct by stratified squamous keratinized epithelium. The passage of the milk from the alveoli into and along the duct is facilitated by a contraction of myoepitheliocyte, which are found both around the alveoli and around the ducts. The stroma forms the supporting framework of the gland. It is partly fibrous and partly fatty. The fibrous stroma forms septa, known as the suspensory ligament of Cooper, which anchors the skin and the gland to the pectoral fascia. The fatty stroma forms the main bulk of the gland. It is distributed all over the breast, except and beneath the areola and nipple. Blood supply. The mammary gland is extremely vascular. It is supplied by the branches of the following artery. Internal thoracic artery, a branch of subclavian artery through its perforating branches. The lateral thoracic, superior thoracic and acromiothoracic branches of axillary artery. Lateral branches of posterior intercostal arteries. The arteries converge on the breast and are distributed from the anterior surface. The posterior surface is relatively avascular. The veins follow the arteries. They first converge towards the base of the nipple where they form an anastomotic venous circle from where veins run in superficial and deep sets. The superficial veins drains into internal thoracic vein and into superficial veins of the lower part of the neck. Deep veins into the internal thoracic, axillary and posterior intercostal veins. Nerve supply. The breast is supplied by the anterior and lateral cutaneous branches of 4th to 6th intercostal nerves. The nerves convey sensory fibers to the skin and autonomic fibers to the smooth muscle and to the blood vessels. The nerves do not control the secretion of milk. Secretion is controlled by the hormone prolactin secreted by the pars anterior of the hypophysis cerebri. Lymphatic drainage of the breast assumes great importance to a surgeon because carcinoma of breast spreads mostly along the lymphatics to the regional lymph nodes. The axillary lymph node, the posterior, lateral, central and apical group of lymph nodes, internal mammary lymph nodes, supraclavicular lymph nodes, cephalic nodes, posterior intercostal nodes, the subdiaphragmatic nodes, and subperitoneal lymph node plexus. Lymphatic vessels. The superficial lymphatics drains the skin over the breast except for the nipple and areola. The lymphatics pass radially to the surrounding lymph nodes. The deep lymphatics drains the parenchyma of the breast. They also drains the nipple and areola. About 75% of the lymph from the breast drains into the axillary node, 20% into internal mammary nodes, and 5% into the posterior intercostal nodes.